I'm a medical doctor with a specialty in diabetes, obesity, and nutrition. And I became interested in becoming a doctor because my mother was a nurse, beloved by many of the patients she treated and by the doctors she worked with. And so I felt, at age 13, I felt called to be a medical doctor and be a caring professional. In medical school, I went into diabetes because my first rotation was on a diabetes ward where all the people had diabetes. And I recognized that diabetes is really a challenging condition. And I thought that I'd like to specialize in helping people with diabetes. Vietnam was really crazy at the time I went to medical school. And I volunteered with the Army. I found out if I volunteered to go peacefully, they would let me finish my medical training. And so basically I agreed to enlist in the Army after completing medical school and my medical residency. So I did that. I arrived at Fitzsimmons Army Hospital, a terrific assignment, a great hospital in Denver. And I quickly learned that I would be in a group that were on call for Vietnam, and I would be given a 6-week notice when I'd have to go to Vietnam. I said, wait a minute. I have a family, and I said, what can I do to avoid that call to Vietnam duty? They said, well, if you give us an extra year, if you do 3 years of work here, we'll excuse you from going to Vietnam. I said, it's a deal. And this was sweetened by the fact that a very well-known medical researcher and doctor ran a research lab there at Fitzsimmons Army Hospital. And he did nutrition research. He fed diets to people to check on their diabetes and how their cholesterol responded to diets. And also he fed rats and animals diets to test out which is the best thing for lowering cholesterol and for helping diabetes. And so I was able to work with Dr. Bob Herman for 3 years. That was a terrific experience, and that really gave me the credentials to be an obesity specialist and a diabetes specialist. For my education, I went to the West Virginia University to get my BS degree, and then went to Northwestern Medical School to get my MD, and then I went to Mayo Clinic to do my training in internal medicine. As I say, my experience in the Army gave me then my credentials in nutrition and diabetes. Out of my research, I published 15 popular books, 400 scientific papers, and I lectured in 34 countries around the world. I love to travel, and so I really enjoyed that. Some of the things that I thought were really important was we developed a weight loss program that was very effective. We published a number of papers on our weight loss, and people lost more weight consistently with our diet than with any other diet out there. Weight Watchers, etc., didn't hold a candle to our weight loss. For example, I personally supervised 200 people lose more than 100 pounds. I called the Quaker Oats Company and asked them about oat bran because I thought it would lower cholesterol. The lady said, well, we don't have oat bran. I was stunned when I called her, and so I called back in a few minutes and I said, is this the Quaker Oats Company? She said, yes, sir. I said, if the Quaker Oats Company doesn't have oat bran, who would have it? She said, well, sir, actually, we use oat bran in animal feed. If you call the guy in St. Louis that's head of milling, he might be able to help you. So I called the miller in St. Louis, and I told him I thought oat bran would be really good human food for lowering cholesterol, and he was super excited. He said, okay, Dr. Anderson, I'll ship you a 100-pound drum. So I got that, and I made the first oat bran muffins. My family said they were like hockey pucks. I was called the father of oat bran, or Dr. Oat Bran, and some people wondered whether the 1980s would be called the Reagan decade or the oat bran decade. I was able to do this sort of research. I documented that oat bran was very good for lowering cholesterol, and I went on to popularize high fiber, and now most cereals that have fiber in them advertise that. During the time I was at the University of Kentucky, 38 years, I did an average of 15 lectures in other cities, other states, and I did 4 international trips a year to talk about our research and what was going on with all these areas. What do I consider my personal achievements? I'm an active Baptist, and I was served as a deacon, as a Sunday school teacher in Baptist churches in 4 towns we lived in, 4 cities we lived in. We were active in our missionary work. In 61 years of marriage to my sweet wife, Gay, we've had a daughter and a son. We've had 5 granddaughters. Now we have 4 great-grandchildren. So these are personal accomplishments, I think, that are very important. Yeah. What's a word that I think would describe me? I would consider myself a helper. I think I've helped in the clinics. In my diabetes clinics, my obesity clinics, my nutrition clinics, I've helped countless people. When I retired from these clinics, I had 2 months of people coming in for their final appointment with me, and they were crying. They'd give me a hug, and I'd join them crying and give them a hug back, because I got very close to my patients. I had a number of graduate students. I have maybe 50 graduate students, helping them get their master's degrees and PhDs. I get very close to them. They were like family members. And so I think being a helper is what I would, I think, best describe what I felt like I did. I've gotten my inspiration from the Lord. I think that I've really had this sort of guidance that's helped me, and sometimes I'll pray for something, and then in the middle of the night I'll wake up with the answer I'm seeking. Sometimes I get up and type it on my computer. I'm struggling with how to word something in one of my 300, 400 papers, and it comes to me. So I've had that sort of inspiration. What sort of legacy do I want to leave? I think, first of all, I want to leave, I want my children, grandchildren, great-grandchildren to feel like that I was a loving grandfather, loving figure in the family who really was concerned about people and really was devoted to helping other people in a lot of different ways. How would I like to be remembered? I think George H.W. Bush was a remarkable man, and he was a Christian. He was modest, and he was very open to dialogue, and he could admit he was wrong, and he was not overly persistent. I think that I've worked with many students, and I think I've had from college students through family members. I've tried to be a genuine help guide that was sensitive to their needs, where they were, and coach them and how to progress in what they're doing.